Hi, my name is Joseph, and I am making this video during a time of social distancing and isolation. And I've gotten a lot of phone calls and texts from friends asking me medical questions. Obviously, they're not medical folks, but they were just asking me a lot of questions. So one of them has actually suggested that I make a video in order to help explain some of the details and overview of this coronavirus. I've seen quite a bit of information on the news. Obviously, we're in a pandemic, and there still seems to be a lot of confusion about this coronavirus. So one of the things that I find quite frustrating about this is just observing and seeing out in the community, in our society, people who are clearly just not respecting the expert recommendations made by medical professionals to keep their distance. So I'm going to do my part as a teacher to hopefully contribute to the educational aspect of understanding this coronavirus and this pandemic. I think it's important in order for people to make necessary behavioral changes that they understand why these are necessary in this time. One of the other aspects about this is that I think it's very important to understand how other people's behavior, be it people that are in your family, people that are your neighbors, or in society, how their behavior will eventually affect you or one of your loved ones. So the things that I'm going to go over is the difference between the flu versus COVID-19, since this is something that I've heard a lot of people making comparisons on. The second one, obviously, is the important one, which is how do you get it? How does someone get infected with this coronavirus? And more importantly, how to protect yourself, or at least decrease the chances of you getting this coronavirus. So I'm making this video really to answer some of the questions that my friends have already asked me, but certainly to address some of the misunderstandings that I've seen on the news, especially on social media. So COVID-19 stands for, the CO stands for corona, which is Latin for crown, which is what the virus looks like. VI stands for virus, the D stands for disease, and the number 19 indicates the year in which it was discovered towards the end of last year. So COVID-19 is the actual disease. SARS-CoV-2 is the name of the virus that causes the disease. I'm just going to refer to it as coronavirus, since that's what most people are familiar with. That's the term that most people are familiar with. So one aspect of difference between the flu versus COVID-19 is this concept called the R0. So the R0 is basically describes, it's an epidemiological and statistical and mathematical term used to describe how infectious a pathogen is or a disease is. So the R0 for the flu is around 1.3. In essence, what that number indicates is if one person has the flu, is infected and has the flu, they could in essence, on average, infect 1.3 other people. So let's just say, for example, this one person infected with the flu will give the virus to another person. So the other person gets infected and they'll give it to 2 more people. And after that 2 more people, one person doesn't infect another person, but that second person does and infects another person, such that on average, the original person that has the flu infects 1.3 people. Now, if you go down 10 layers of infection, on average, the original person that with the flu would infect about 13 to 18 people. Now, you compare that with the R0 for COVID-19. The R0 for COVID-19, or the coronavirus, is around 2 to 2.5. And I know that difference of 1.3 to 2 and 2.5 doesn't seem like a whole lot, but imagine so that someone with the coronavirus infecting 2 more people, and those 2 people infect 5 more people. And those 5 people end up infecting 15 people. That's just the average between 2 and 2.5. Now, if you go down 10 levels of that, the original person with the coronavirus would have infected anywhere between 1,000 to 9,500 people. Just 10 levels down, which is crazy. And it really ascribes to how infectious this coronavirus is versus that of the flu. Imagine around 15 people with the flu versus 1,000 to 9,500 with the coronavirus. Another contributing factor to the difference between the flu and the coronavirus and why the coronavirus is so infectious is the incubation period. So with the flu, if you get infected by it, you'll show symptoms within 4 days or so, right? So the window is relatively short Compared that with the coronavirus, the incubation time is almost 2 weeks. So that means that someone could be walking around, obviously with the coronavirus, and be asymptomatic. And it was originally believed that you only can be infectious when you are symptomatic. And we're finding out more information that that might not be true. So you can have a lot of people out and about who appear just fine, although they're infected, and could be passing this virus to other people. Which is why I think countries that have practiced social isolation as opposed to social distancing have made quite a bit of an effort when it comes to reducing this pandemic in their country. So when you do go grocery shopping, yeah, there is an inherent risk associated with that simply because you don't know how many people out there are actually infected with this virus but are asymptomatic. So let's just face it, when you go out there, you take your chances. The third different aspect about the flu and the coronavirus is the hospitalization rate. So with the flu, on average, the hospitalization rate is around 2%. Compared that with the coronavirus, the hospitalization rate is almost 20%. So it's a lot higher, in order of 10. Which leads to my next point, which is the case fatality rate. The case fatality rate for the flu is less than 0.1%. Compare that to the case fatality rate of the coronavirus, which is 1 to 3.4%. That's 10 to 35 times higher than the flu. Just to give you an idea about the fatality cases, by the time you've seen this video, at least 7,000 people in the United States have passed away as a result of this coronavirus. And unfortunately, there will be more people who will be dying from this disease. So let's go over the fatality rate and why it's so important to flatten this curve. So imagine over at your city, there's roughly 1,000 beds. So I'm just using beds as an example because ultimately, in order to take care of someone who's critically ill from this, you need the bed, you need the medicine, and you need the staff. So all these resources are necessary in order to just increases your chance of surviving, because you're not guaranteed of survival just because we have a ventilator or a bed for you. But certainly without it, your chances of dying would be much higher. So as the number of cases of hospitalizations from the coronavirus increase, it'll exceed the amount of resources that we have available to treat you. So once we go beyond that level, a lot more people will die as a result. And this really isn't necessary if we just do our part when it comes to doing social distancing, washing your hands, etc. How is this going to be relevant to you or indirectly relevant to you? As the number of cases exceed the number of resources available, imagine if you get hospitalized. If you do something, you break your leg, get into a car accident, etc. We at the hospital have to prioritize those that are more sick. So if someone is really ill as a result of this coronavirus, we might not be able to see or attend to your sickness or attend to your car accident, broken bone, what have you. That's how behavior from other people in society who, quite frankly, just don't give a crap and don't think that it's going to affect them will end up affecting you or your loved ones. So let's go over how you can get it. So there are really three main methods or three main routes that the virus can infect you: eyes, nose, and mouth. A face mask will cover your nose and your mouth, but it doesn't obviously cover your eyes. So that's still one way in which you can still get infected. So if a person coughs, sneezes, or let's say talks really close to you, you can still get infected despite wearing a mask. So that's something to consider. So let's go over how to protect yourself. I think it's really important that if you're a parent, that you educate your children on not only how they can protect themselves, but why. So let's go over it. Obviously, washing hands with soap is very important. And the reason being is because soap actually kills the virus. But secondly, it's the virus getting on your hands. Your skin actually acts as a very good barrier against the virus. The problem is if you touch a counter or touch something that has the virus on it and you end up touching your face, and not so much your face, but inside your mouth, nose, or eyes, that's how you get infected by this. So the second thing is don't touch your face. There have been quite a few studies that looked at how often people touch their face with their hands subconsciously. On average, the numbers range between 3.5 to like 15 times per hour. That's how often you subconsciously touch your face. So take a look around. I mean, look at your kids, look at your spouse, and see how often they actually touch their face subconsciously, despite being told not to. Which is why it's important. If you're going to end up doing it subconsciously, you can't fault them for it. Make a conscientious effort not to touch your face. But another way in which you can protect yourself is just by washing your hands regularly with soap for at least 20 seconds. The third way to decrease your chances of getting the coronavirus is doing social distancing or social isolation. Obviously, you're gonna have to go out and do grocery shopping, etc., whatever other errands that you need to do. But it's important that you keep yourself at least 6 feet away from other people. And it's gonna be really difficult to do, which is why social isolation theoretically would decrease your chances even further. But with social distancing, one of the CDC recommendations is to keep yourself away at least 6 feet away from other people. And even then, the science behind that is somewhat So the data behind the 6 feet thing is actually based on several studies which looked at microparticle emission as a result of sneezing and coughing. So they found that you can literally sneeze and cough microparticles out that will land about 5 feet away. So 6 feet recommendation. This is a nice photo that really shows you what happens when someone sneezes or coughs, because it really shows how many microparticles are actually emitted as a result. One other aspect that doesn't get taken into account is just me talking right now actually emits microparticles. And if you're infected with those microparticles, obviously just talking to someone can emit these microparticles, and you in theory could infect someone else either, which is why it's recommended that you stay 6 feet away from each other. The caveat to some of these studies is that it was done indoors. So what it doesn't take into account is wind. So I don't know if you cough and or if you sneeze in an outside environment, the wind could carry this further. And one subsequent study says that this could actually go out as far as 27 feet, which is why going outside, you're still posing yourself as a risk versus social isolation. The other thing that I wanted to discuss is the 3 methods in which you can get it, as I just mentioned. Someone coughing or sneezing on you, or even talking to you up close without a mask. The second way is through a direct contact, which is, you go up and you shake someone's hand and that person happens to have the virus on their hands. You end up touching your nose and your mouth, and that's how you get infected. The third way is through indirect contact. So basically they touch something and then you subsequently touch the same thing. So an example of this would be doorknobs. One of the things that I found out recently was I went to go get gas, and I realized, wow, the gas pumps are a major source of just people touching their hands on something very frequently. So eventually you're gonna have to go get gas. So I would recommend that you not stay away from getting gas, but certainly be careful when it comes to washing your hands, maybe with an alcohol swab after you get back in, just before you touch the steering wheel. But if you do get home, wipe everything down. So the last aspect, especially for those people that are going out and about, trying to keep their social distance and then coming home to their family. The way in which this virus spreads in the community isn't so much based on the people that are doing their part when it comes to social distancing or social isolation. The capability of this virus to move really comes down to the weakest link in the armor. If you have several people that are just going out and about, you can imagine, based on the example that I showed you earlier, that they can infect literally thousands of people. And this has actually been shown over in China, where they literally tracked one person. They found that this one lady had ended up infecting thousands of people. Occasionally, I think what you'll see is, at least on the news, that an entire family has been infected by this virus. I recently found out just a few hours ago, just talking to my mom, that one of my friends who's a neurologist, his entire family is infected by this virus. And he's currently hospitalized, and the entire family's at home quarantine. The reason why you see families being infected is because, let's face it, you or your family trust everyone in the group, in the family. But your ability to avoid or at least decrease your chances of getting infected by this coronavirus is highly dependent on the weakest person in that link. Very much like society, you have a group of people who may not be listening to these medical recommendations of social distancing. They're going to end up infecting their family or loved ones, and really that's where you get that pull. So for example, if you look at the United States, look at these pockets of infection, like New York being number one, Louisiana is getting really bad, Washington, California. If we can educate people and let them understand how this thing spreads, we can flatten this curve and hopefully avoid all these unnecessary deaths that will ultimately be coming, because let's face it, it's impossible to get everyone to comply. So for the last part, this message is for all my healthcare professional colleagues. One, if you're sick, please stay at home. Don't come into work and infect everybody else. I have a story. One of my friends is an endocrinologist down in Houston. She has a colleague who's a physician at the hospital. And what they've done over at most hospitals is that they've closed off all the entrances. And there's really only one way in to get to the hospital. And what they have stationed there is a table with people that measure to see if you have a fever or an elevated temperature. Well, this physician went in, he was feeling under the weather, but he was like, whatever, blow it off. And he tried to go in anyways. Well, they found that he had an elevated temperature and they tested him, and guess what? He tested positive. So thank God for the security people there, and thank God that the hospital made the effort to make sure to evaluate everyone that's going into the hospital. So for those that are still in on this fight, and we're really gonna have to hunker down, because this is going to be a long one. It's gonna be a marathon. Fortunately, they've come out with new tests. I know they're still working on that vaccine, but it's a long ways away. Which brings me to my third message, which is research, which is something I've always been interested in. So if your hospital is not involved in the Solidarity study, please consider enlisting. Basically what it is it's a phase 3 multinational all-out effort sponsored or run by the World Health Organization. So there are 4 treatment arms in this particular study. The first treatment arm is remdesivir. It's an antiretroviral. It was used against Ebola. And it shows in vitro promise against COVID-19. The second treatment arm is chloroquine and hydroxychloroquine or hydroxychloroquine. I think Trump made a comment about that. That was put into this particular study to evaluate it. The fourth treatment arm is Kaletra, which is an antiretroviral protease inhibitor used for AIDS patient. And the fourth treatment arm is Kaletra plus interferon beta. So these 4 treatment arms are being compared against standard of care. So the World Health Organization, like I said, is trying to get every country in the world to participate in this study. The sooner that we enlist the number of patients necessary for this study, the quicker we'll have the data. And with that, we'll know that which treatment options will actually work best for our patients. You do not need all of these drugs on your hospital formulary in order to participate in this study. You only need one of these 4. So please consider enlisting your hospital into this cause, because like I said, the sooner we get this study done, the quicker we have the necessary data to show which one would actually work against the coronavirus. France is actually doing a similar study called the Discovery Study, and it only has 3 treatment arms. So all those treatment arms from the Solidarity study minus chloroquine and hydroxychloroquine. So for everyone else out there, I know that right now things seem very chaotic, especially over at the hospital. One of the issues that we're encountering over at the hospital is triaging. So a lot of people are coming in thinking that they have the coronavirus, and so they get asked a set of questions, and often many of them will get turned away simply because they don't meet the criteria to get tested. So if you think you might have the coronavirus, but you don't want to overwhelm the hospital emergency room, please consider going to this website. It was developed with a set of questionnaire developed by Emory University, the ER department. It's called c19check.com, and I've left the link here. So this particular questionnaire is actually rather simple. It only has 5 questions. The first question asks for your age. The second question asks for the zip code that you're in. The third question is basic symptoms, what type of symptoms you're having. And then the fourth question asks for more detailed symptoms about those symptoms. And the fifth question is comorbid conditions. So if you have hypertension, diabetes, etc. If you answer those questions, it'll pump out basically a result which would recommend that you either stay at home, quarantine yourself, or go into the hospital and get yourself tested. One of the things that I find particularly interesting that it wasn't included on the Emory website questionnaire is the number of cases, or at least over in South Korea, of people having anosmia, which means that their sense of smell and taste was gone. That was shown in almost 30% of these patients. It's something that's particularly unique about this coronavirus. So one of the scary things, at least for me, is going into the hospital, because we know that we're taking care of coronavirus patients there. But every time we step in there, we increase our chances of contracting this virus. I mean, the hospital has done their part in trying to quarantine certain wings specifically for COVID-19 patients. One of my concerns after this is I don't want to take my chances of going home to visit my parents, to visit my nephews and nieces and my siblings. So it's tough from that respect, but kudos to all the people that are working in the hospital to try to take care of these patients. But one thing that we need from everyone else really is to try to stay at home and decrease your chances of contracting this virus. In the future, things will get better, simply because I believe that we're going to come out with a vaccine for this. We have plenty of researchers working on this. Until the time when the vaccine is created, really this is the most dangerous part for us, is at the very beginning, where our bodies just have not been exposed to this virus. So I think I've covered everything that I've wanted to say. With that said, I need to get to work. If you find this information useful, please forward it to other people, especially for those people that aren't practicing social distancing. What we need to do as a society really is to flatten this curve until we can get treatments out there available. With that said, be kind to each other, be nice, be safe, and be smart about this, okay? Ciao.